Good morning, Neurodivergent Nation. Want to understand autism better? Let's talk about what I believe to be one of the most influential brain chemicals related to autism traits and features in some autistic individuals. Oxytocin. AKA the love hormone, AKA social hormone, AKA cuddle hormone. You produce oxytocin when you experience a number of things, like making friends, when you become attached to someone and get excited about seeing them, or when you have an orgasm, or when you savor a fine dark chocolate. Those are just to name a few. Oxytocin plays a vital role in breastfeeding and childbirth as well. I believe it's important to understand this hormone if you're autistic because it plays a huge role in so many of our behaviors and motivation that affect many autistic people because others don't think you're doing the behaviors in the right ways. Well, you're not doing them wrong, you're doing it like an autistic person does it. And that's okay! What are these behaviors? Well, attachment to other people, how we respond to other people, social functioning, how we trust others, biological functioning, and a lot more. If you've seen some of my other videos, you know that one of the parts of the brain that's most responsible for autistic features and traits is the hypothalamus. So check out my brain on interoception, and this will explain a lot about your body's responses, about body temperature regulation and thirst and hunger, etc. If you haven't subscribed yet, please do that. When you click on a video, the YouTube algorithm helps other people find the videos who might need help with autism as well. So please help others by subscribing, liking, and sharing these videos. In the typical brain, the hypothalamus is where the oxytocin is produced by neurons, which then project to other areas of the brain, such as the olfactory bulb region, which helps process social information and controls excitement and inhibition and social recognition. And get this, it helps to not get so upset about receiving bad social information. This means it helps people not get so butthurt. It helps them recognize social cues better and helps them not say the wrong things when talking to other people. In many cases, the autistic brain has differences in these areas that make these things more difficult for them. Not because they're being an ass, but because there is a neurological difference that can't always be helped. Like anyone would want to feel butthurt all the time, or say embarrassing things, or get overly excited when talking about something that nobody else really cares about. Like, honestly, who would sign up for that? These oxytocin levels also affect the nucleus accumbens, which helps with social reward learning. When autistic people were tested, results suggested that the level of attachment and affiliation was correlated with their oxytocin levels. Lower oxytocin in the blood meant less attachment. You probably already know that a couple of hallmark features of autism in many autistic individuals include differences in social functioning, attachment, affiliation, how you perceive and provide affection, how you respond to threats. Sometimes I laugh at inappropriate times. I don't mean to, but it's just the way it is. But these are all related to oxytocin levels. In addition to the previously mentioned traits and features, research also suggests that those with ASD may be at greater risk for overeating because of its potential for high reward. This is also often related to oxytocin deficits and receptor site differences. But in reality, is it really just the oxytocin levels that are problematic? Let me explain. Oxytocin is the neurotransmitter, but neurotransmitters have to dock onto receptor sites to be effective. And in this case, there have been differences found in the receptor sites in autistic individuals as well, which means oxytocin doesn't always bind to the receptor site as one would expect. Those differences can lead to social functioning problems, depression, irritability, and not feeling very affectionate. Basically, a lot of the things that we've already talked about. There have been clinical trials using oxytocin as a treatment, and while it showed some promising results in certain single-dose trials, overall, long-term effects from multiple doses of oxytocin have produced mixed results, with outcomes related to social interaction being insignificant. But there have been some significant results with the reduction of repetitive behaviors and attachment. So sometimes just giving additional levels of oxytocin, it might work a little, but it doesn't always work as researchers had hoped, but in some cases it makes a little bit of a difference. But researchers are constantly trying to come up with different treatments for autism, different pills to take, different nasal spray concoctions, and they're not as successful as they had hoped. Could this be because there might be more to autism than just a few differences in receptor sites and neurochemicals? They haven't yet proven that all autistic individuals have lower amounts of oxytocin in their system, so it's got to be more than just that. Doesn't it make sense that interpersonal interactions are also related to habits and masking and environment and a whole load of other factors. And isn't this one of the main problems with those who are so desperate to pin autism to some reason, some mutant gene?
There's someone on the way, something.
Or if you want to go back through history, pinning it on frigid parenting or getting your measles shots. And isn't it suspect that so many want to find a pill like to treat it or cure it or even worse, eradicate autism in the future? I do understand that people who have severe deficits related to autism are looking for relief. I totally get that. I do. I understand also that there is a place here in our world for all levels and flavors of autism and their families and their loved ones. Just yesterday, I was at the home improvement store, and a father and his autistic adult son were there. My heart was so full of love watching them interact. The young man was behaving in a way that others seemed uncomfortable with, but the dad wasn't bothered by it, and I wasn't bothered by it. I wanted to talk with them so badly, but that wasn't my place to do that, so I just admired the love and relationship between the two from afar. Now, would that person or lots of other autistic people benefit from a pill or a spray to help them have greater levels of oxytocin? Maybe, maybe not. I suppose like everything, it's up to the individual, and maybe the scientific community is trying to provide options. Maybe the pharmaceutical companies are trying too hard to make their next billion from autistic people. Maybe some autistic people have accepted and love who they are, the way they are. Maybe it's all true. Maybe these are all things to consider. Anyway, I am the Neurodivergent Doctor, and I hope this helps you in your neurodiverse universe.